if you don't understand, I was taught there's no Lyme disease in Michigan. So I brought this brochure here from the animal hospital in Cascade, Michigan. And if your local dog can have an incidence of 500 to 1,000 cases of Lyme disease, okay, your horse or your cat can have Lyme disease in the state of Michigan, that means the germ's here, and you might have it also. So Lyme disease is in Michigan, and the president of the Michigan Lyme Association, who was diagnosed with MS, which is a disease that nobody knows why you get it, when she was treated for Lyme disease, her problem went away. That's number one. You have to recognize it. Can I see that paper, please? The second thing is doctors don't like to be stumped. So somebody comes in with these unusual complaints, and it's like a masquerade. You got to figure out who's behind the mask. And a similar disease to this problem was syphilis a long time ago. And syphilis is a spirochete like Lyme. And syphilis can exist in many forms in the human body. And so we call Lyme disease the great masquerader. So some people could have brain fog, some people can have arthralgias, aches and pains of the joints, some people can have aches and pains of the muscle, which would be fibromyalgia. Some people might have MS, multiple sclerosis. Some people have Lou Gehrig's disease. Some people have polymyalgia rheumatica. You know, and the most common one is rheumatoid arthritis. Now, that's where the word Lyme came from. Lyme, Connecticut, all the children, not all the children, many of the children had something called juvenile rheumatoid arthritis, which is supposed to be a very rare disease. And the mother said, this is very unusual that all our children have rheumatoid arthritis and other children don't. So maybe they have something else in this, vague diagnosis. And some doctor from Yale went over there and said, you're absolutely right, they have a spirochete. And they have Lyme disease. Now, I've met with rheumatologists, and I said, first of all, if a person has deformed joints, and you do a rheumatoid test on them, is it always positive? And they said no. And I said, do you treat them for rheumatoid arthritis? And they go, yes, because they have deformed joints. They have the symptoms of the disease. Then I said, okay, now some of these people with deformed joints who test positive for rheumatoid arthritis, which just means they have an autoimmune disease, but it doesn't tell you why they have an autoimmune disease. And autoimmune diseases occur for one or two reasons. One, you have toxins in your body like mercury, lead, arsenic, cadmium, aluminum. Or B, you have an infection. It could be a Lyme germ. So the rheumatoid arthritis doctors say, well, occasionally my patients do test positive for Lyme, and then I give them doxycycline, and I say, what happens? Well, they get better. So my question is, since we give doxycycline to high school acne children every day of the week, why don't you just try for a month giving your rheumatoid arthritis patients doxycycline? Because just because they don't have a positive Lyme test doesn't mean they don't have the disease. The second thing is that you have to know how to diagnose the Lyme disease, and there's 60 government-approved labs in the United States, which means my Blue Cross Blue Shield or my Medicare policy will pay that lab to do the test. It's not a fly-by-night lab. It's a government-approved, meets all the qualifications. There's only one really good lab in the United States to do Lyme testing, and that's all they do. They specialize in Lyme testing. And my analogy is, if I have a Ferrari and it breaks down, am I going to take it to the local Ford dealer? And the answer is no. It's a rare car, and I'm going to take it to who knows how to do the test. Who knows how to fix it?
Is that lab in California?
That lab is called IGeneX Labs, and it's in California.
Oh, I'll tell you.
Yeah, and that's where we finally sent Michael's blood, and it became positive, the Western blot, which is the gold standard blood test for Lyme disease. But Lyme disease is a disease based on symptoms. You don't need any blood test to be told you have Lyme disease. But insurance companies, for some reason, balk at treating people for Lyme disease if they have the symptoms but don't have a positive blood test. So you got to understand you have this masquerader. Then the next problem is, how do you treat Lyme disease? And first you have to understand the disease. A simple example is if I get an infection in my skin and the germ is tetanus, it releases a toxin that goes throughout my body and makes me sick. Okay, and so I get toxic shock. Okay, the bacteria might be releasing the toxins, and to kill the bacteria is a good thing, but that doesn't remove the toxins. So when a person has Lyme disease, it's understood that there's over 150 toxins released by the germ. And those toxins have to be removed from the body. And the damage they do to your nerves, which might be in your brain and cause brain fog, or the nerves that might affect you to cause multiple sclerosis, or the toxins in your joints that cause the inflammation, if you don't remove them, the inflammation doesn't go away. So you'll hear story after story of people taking all different antibiotics for years and years and years and never get better. Because if you don't eliminate the toxin and fix the damage, it's like Katrina. Katrina hit New Orleans, that's the germ. Katrina went away. Is New Orleans still a mess? Yes, it is. All right? So you got to have the cleanup crews and the repair crews. And that's what I do. I do a holistic concept where we clean up and repair the person's body. And on top of that, we try to make the body so healthy that next time they get bit by a tick, they don't get the disease. It's sort of like getting on an airplane. You get on an airplane, and there's a person who's sick on the airplane. When you get off the airplane, some people get sick and other people don't. The people who get sick are the people with the weak immune systems. So if you have a healthy immune system, you might get bit by ticks and never get the Lyme germ, just like people have intercourse with HIV patients and never get HIV. Or they might have HIV like Magic Johnson and 10, 15 years later be completely normal. Because Louis Pasteur said it's not the germ, it's the terrain. That means the health of your body is more important than the germ. And what I do is, my job is to make Michael's body so healthy that the germ won't want to live there. Okay? By the way, I have a couple more patients I want you to interview, but in Germany they have like a 2-week cure for Lyme disease.
You're just going right through my questions. I love
Yeah,
this.
just keep going.
Okay. So
How do you do that? Get out of my head.
now, there was a spirochete in the United States called syphilis. And prior to 1940s, when syphilis got into your brain, your central nervous system, there was no drug that could get into your central nervous system until they invented penicillin in the 40s.
Mm-hmm.
And then penicillin would make,
Do you know who came out, the first company to come out with penicillin?
no. But the point is, the treatment to make people with syphilis better was give them malaria. When you got malaria, the fever and the high temperature killed all the spirochetes. So the Germans, they know this, and by the way, the first case of Lyme in the world was documented in the 1860s in Germany. And the Germans have this program where they actually anesthetize you and heat your body up to about 108 degrees. And it takes about 8 hours to do that, and I've had 300 patients get heated up, and no one's been hurt, and no germ is left in their body. And that's pretty incredible. And so if you want to get your Lyme disease gone in 2 weeks, they give you a couple IVs like Michael's getting, vitamin C and things to detoxify your body and natural antioxidants. But in Germany we have that 2-week program, and I've had between about half a dozen people go over, and to this day have great immune systems and no sign of the Lyme germ.
So it's 100%?
Yeah, so far. And the
Okay.
Germans have treated at this one clinic we were just
Pretty good.
visiting last week when I gave a talk in Germany, have had over 50 patients at their clinic that they've heated up. And this works for all viruses, by the way, or other germs. This is a spirochete, but it will work for hepatitis, they tell me, and HIV too. But it's been around since the 1940s. The Merck manual in the 1940s said heat the human body up and you will kill the germs. So,
It's not covered by insurance, I'm guessing.
What's strange
Some,
about it,
is it?
yeah,
Yes.
there's a thing called a global billing insurance company. Now, if you have HMO insurance, that usually allows you only to see the local doctor. But if you have a good insurance policy, they allow you to have treatments to make you better. Okay? A good insurance policy would be a good Blue Cross policy, top of the line, a MESA school teacher's policy. Those things reimburse people. So I've had people with Lyme disease go to Germany and get it fully reimbursed. And if you can stick around to, like I wrote you on the note, to 5:30, I will introduce you to a gentleman who's done, you know, IVs, been to several doctors, has his own hyperbaric chamber, which is a treatment for Lyme disease, and that still wasn't 100% better. And we sent him to Germany, and he came back, and his Lyme was gone. He had no Lyme symptoms, and that was a while back. So we have people several years out now who have been treated. And if it doesn't come back in 1 year, it's not coming back.
If I were to write a check for that treatment today, what would it cost?
Well, euros, it costs you 12,000 euros. What it costs in American dollars depends on what the exchange rate is today.
Right.
And when we just came back from Germany last week, $1.40 equaled 1 euro.
All right.
So, if I had Lyme disease, you know, I would go to
Germany.
I'd go to Germany
Let's go
because
to Germany.
I
During
mean that's
Oktoberfest.
less than 1 year's income.
Better go
You know,
drinking.
I mean, it's over and done with. It's safe, like I said. I've had 80-plus-year-old people get heated up without any side effects, and I've never known of a person.
Now,
Now you have to be healthy to go over there, somewhat healthy.
Yeah.
So what I do is I prime people, because people come in here eating the wrong foods, on no supplements, just taking antibiotics, and they're very unhealthy. Their bowels don't move twice a day, they don't drink half their weight in ounces of water, they don't eat organic food, they don't drink purified water. And we teach them how to do all the right things so they get the best response. Sort of like if you're going to enter a race with your car, you want it tuned up before you
Right.
enter the race.
What is your take on like aspartame and Splenda, things like that?
I think they call Splenda similar to chlorinated water. And aspartame, which is made in Germany by Monsanto, the chemical company,
Nice guys.
has a skull and crossbones on the back.
Right.
Okay?
Yeah.
And basically it's like injecting yourself or drinking formaldehyde.
Right.
Right.
Smoking a D-cell battery.
And the people who work at the plant don't really enjoy retirement too much.
Right.
Yeah, I've had MD's friends go over there and visit the plant,
Wow.
so
Man.
haven't been there myself.
Man. So,
Word of
okay.
mouth.
So,
So that won't help your Lyme disease.
well, if, right. So you might want to
Don't
take
do
that
that.
out of your diet.
Right, right.
But okay, my sister has the ALS type, and she was in ICU just this morning, and I'm wondering what would a course of a graduated course of getting her prepped to go to Germany? How would we go about that? She's on a BiPAP,
Right?
and it's complicated.
Yeah, is she in a wheelchair or just completely?
She's in bed.
She's completely in bed.
Yes, and I completely baffled one of her doctors last night that came in and gave her the whole prep on, okay, you're gonna stop breathing, and then we're gonna have to give you a trach, and then you're gonna have to get a feeding tube. And I said, you need to stop talking to her like that. I said, don't talk to her, don't say that anymore to her. And he's like, well, what are you talking about? And I'm like, well, we've talked to another doctor that says, no disrespect intended, I can see how a neurologist would think this is ALS, but it's not.
Well, we
It's
have
the-
a
it's
very
the
famous
toxins.
person here in town who was told by University of Michigan he had ALS. And he came to see me a decade ago.
Mm-hmm.
And he is still working full-time at one of the biggest churches here in Grand Rapids. And he doesn't have ALS anymore. He never had it.
It just disappeared, huh?
It just so you don't have it. If it
Well,
goes
I got
away,
that's what the doctors tell her, that some patients get pain, some patients get some, muscle strength back. I mean, you know, a month ago she couldn't pick her hands up. Now she can push your hand away from her.
It's like playing Monopoly with a 10-year-old.
Hospice stopped
You know,
coming into the house
just
because they
making
said
the rules up.
she's not dying. Why are we here?
But the program we would give your sister
Yes.
is similar to the program that Michael has. These IVs have been used on Olympians who have developed ALS.
Okay.
And we do a blood test through Johns Hopkins on what's called fatty acid analysis, which is the materials of your brain. The movie was with Nick Nolte about adrenoleukodystrophy, which is a brain disorder that kills all these kids called Lorenzo's oil.
Right.
Okay, and so that was an incurable disease that killed everybody, and now nobody dies from the disease because the kid had a fatty acid analysis and fixed his fatty acids that make up his brain, and that's the end of the story.
Yeah.
Are you familiar with Dr. Richie Shoemaker at all?
Yeah, he wrote Desperation Medicine.
He's the one that we've been talking to. Who
He was the one that I referenced last
she
time.
actually had some blood drawn today to be sent off to get some tests done so he could
Right.
look at
It
them.
sounds like you guys are in
Similar.
similar schools of thought. And,
Right, the other thing that would help your sister would be hyperbaric.
Absolutely.
Yeah.
Can we just put one like over her whole house?
But what they do is the hyperbaric chambers that we're using now have a Hoyer, and they can take people, lift them up, and slide them in the chamber. But see, hyperbaric's not approved in the United States. It is used in other parts of the world for neurological disease with great success. I just had an editor from Lansing newspaper who's, quote, disabled, who was in here and been to like U of M and all these other places. Side of his body was not paralyzed, but grossly weakened to the point he could barely walk in the office. Big tall guy, played basketball coach, jogger, and now he could barely walk into the office. They were giving him IVIG, which is intravenous immunoglobulin,
Right. Yeah.
spending hundreds of thousands of dollars. It didn't make him better.
It's really relatively expensive. Yeah.
So he came to me, and I put him on this program, and I said, go get 40 hyperbaric treatments. And we arranged, now hyperbaric at the hospital is $1,600 a treatment, and it's illegal to do on brain damage. I sent him to a clinic where you could get the hyperbaric for $100 a treatment. That's 1/16 the price of a hospital.
Right.
So $4,000 later, he walks into my office and says, now I ride a bike a mile to the track. I get off my bike, I walk around the track, and I run around the track. And that's in 60 days' time after 5 years of being unable to barely walk. That's a pretty remarkable turnaround.
Yeah.
When I was in Germany, there was a lady with Ted Kennedy-type brain tumor. She arrived comatose. Okay, there's so much pressure on the brain. They did this heat treatment to her brain, and I've had it done successfully on my patients that have gone over there. And she was laughing, and they were pushing her around in a wheelchair because she still wasn't completely better. She still had some left leg weakness at the time. So heat
I would
treatments.
take the left leg weakness right now.
Yeah, and be out of a coma. Yeah,
Yeah.
sure. With just a couple of treatments. So there's things in medicine, and like you said, I work in the box. If you got strep throat, I'm going to give you penicillin. But I'm also going to teach you how never to get strep throat again.
Yeah.
Okay? And if it works in the box, fine. But I'm not going to cover up your symptom. You're not Prozac deficient when you're depressed. You might be tryptophan deficient, okay? So I'm going to fix your problem, all right? And that's what I do. I solve problems. And that's why these people are here.
Yeah. Yeah. Okay. Well, we're gonna send you all of our charts and a check. You just fill it out.
Let me tell you one other thing. First of all, Robert's going to be here in a minute, and then I have another person stopping in. This is from the Journal of the American Medical Association, and this is the tick bites usually, when you get them, if you're lucky enough to have a rash, which occur in less than half the people, don't necessarily look like a bullseye.
Right.
That's on the person's shoulder, all right? Because the tick crawls up to the highest part of the body till it finds a restriction. So the bites are usually on the upper thigh or the upper arm. Okay, second, ticks live in 3 life cycles. You got the larva, okay, you have the nymph, and you have the adult. And whether you take the dog tick or the deer tick, the actual size of the tick is in the circle here. It's about the size of the dot of my pen. Now, if this little guy transmits 80+% of the disease, how many of us have eyes sharp enough to see that? Okay, and even if it's on the front of our thigh, not the back of our thigh. And if you don't get the rash, if you don't fall in that 33% group, then you don't know you were bit, and you don't have a rash, and then the next thing you know, you have these unusual symptoms that nobody can diagnose, and then you have a disease that people give a name to so they can bill an insurance company.
Right. How would you feel about this? How do you think that there are many people out there that have Lyme disease?
Oh yeah, I think it's the most. I think it's the #1 misdiagnosed disease in the world.
All right. Well, tell me this: how much is an independent one-shot Western blot? How much does that run?
Well, when they do the Western blot, they do 2 antibodies. They do IgG, which is long-term memory, and they do IgM, which is recent infection, and that's roughly $100 a test.
Okay.
So it's $200. The secret for Lyme is when the people come in, their immune system's so beat up. In a Western blot, you're asking their immune system, their antibodies, can you identify these 16 different proteins? And if your system's really beat up, it has trouble identifying anything. A person with cancer, what we used to do in the hospital is we used to give them a TB test, a chickenpox test, and a couple of simple viruses that they had as a child. And the sickest people don't respond at all because your immune system is so weak, they don't even respond to what they've had, as a child. So when you do a Western blot test on a lot of people who come to you, who've been to doctors for years and been misdiagnosed, their immune system's so beat up, the test is negative. So what I do is I say, look, I can do your test today, but it's been shown that if you take almost any antibiotic that kills Lyme for 4 weeks and then come back, the test stands a greater chance of being positive. And by being on an antibiotic for 4 weeks, it sort of takes the workload off your immune system, so your immune system can get a little stronger. And we're just asking your immune system, have you seen this guy before, like a lineup? All right?
Yeah.
And so there's tricks to testing people. And then most labs, like the average lab in the state of Michigan, just takes the 16 antigens, proteins from one type of spirochete, and there's other varieties of spirochetes, just like there's other varieties of HIV.
Well, isn't the Western blot based on a European or German spirochete?
Well, no, there's different Western blots.
Right. Okay.
Okay. And there's different forms of the spirochete.
Yeah.
Okay, it's mutated. It's a smart germ. It can live in 3 different forms in your body. Okay, it's a smart germ. It can live tangled up inside your cell membrane or inside your cell. So how do you kill something that's hiding inside your cells without trying to kill your cells? So it's a tricky thing to kill. So that's why if you make the body healthy, some people, like when you talk to Stacy over here, she's been off antibiotics, and she's better now than when she was on antibiotics.
Yeah.
And how do you explain that? The natural ways to kill germs have been known for years. The monks took garlic during the plague. Vitamin C, Linus Pauling got 2 Nobel Prizes, said vitamin C kills germs. And then sodium chloride, salt, kills germs. Okay? And then here's another big point. When you get bit by this darn tick, what you're doing is getting the germs from its gut. And there's not just one germ in that gut. There's lots of other germs. Okay? And the Lyme germ might not be the dominant cause of your disease. It might not even be the cause of your disease, but you have these other tick germs in there. So you have to check for those other germs if the person's symptoms are a little different. We have a handout. We say, okay, these are the symptoms of these other co-infections. Do you think you want to be tested for these? Okay, and then we do that.
Yeah. The reason I was asking about the Western blot test was because we were actually thinking about going out to Hygienics and talking to them about possibly having like a state-funded policy of if you want it, you can have it.
Mm-hmm.
Testing for Lyme disease. And, you know, two things would happen. People that would want the test would be able to have it at an affordable price without
Right.
having to have it prescribed.
Right.
And you get a pretty good indication